Yeah, thank you so much for the kind introductions, and thank you so much for the invitation to present to you today. As you are aware, we're going to be presenting on a new tool that we've recently disseminated. It isn't published yet, and that is the Implementation Research Proposal Appraisal Criteria tool. I'm going to hand over to Rachel now, because she's going to briefly present on the ImpRes tool, because the ImpResPAC tool is based on ImpRes. So we thought it'd be quite useful for you to have a really brief overview of what the tool is. So, Rachel, if you can just give me some indication of when you want me to switch.
That's great. So if you could just switch to the next slide, that would be great. Yeah. Thanks, Louise. And this is just to say, before I start talking about ImpRes, just to acknowledge all those that have been involved in the ImpRes and ImpResPAC research team. So just the names of those people here, and just to say a big thank you to them. Next slide, please. And also just funding acknowledgements. So the research was funded by the National Institute for Health Research as Applied Research Collaboration, South London. Next slide, Louise, please.
I'm trying. There we go.
Okay, brilliant. Thank you. So as Louise has already said, we will be focusing the talk primarily on ImpResPAC, which is a quantitative appraisal tool developed on the structure and content of the ImpRes tool and supplementary guide. But before we start talking about ImpResPAC, I just wanted to spend a bit of time talking about ImpRes for the benefits of those of you that may not have heard of this, and also because I think it's important, given, as Louise has already said, this is what ImpResPAC was based upon, and this is what she'll be talking about after me. Now, just to also say before I go on, I'm afraid due to unforeseen circumstances, I won't be able to stay for the whole call today. So I'll be here for my part of the presentation and hopefully some of Louise's, but I won't be around for the questions at the end. So please accept my apologies for this, but Louise will be able to answer any questions we have, and I'm of course very happy to be contacted by email afterwards as well. So please don't hesitate to reach out if you want to. Okay, so just talking about the overview today and what we're going to discuss. So I'll start by talking about ImpRes and why this was developed and is important, and I'll bring into the discussion here the importance of appraising implementation science proposals and how ImpRes can help with this. And then I'll pass over to Louise, who will talk about the development of ImpResPAC. And this is what most of our presentation today will focus on. So Louise will talk about how ImpResPAC was developed and evaluated, and then discuss what she sees as the priorities in terms of directions for future research. And then there'll be time at the end for questions as well. Okay, next slide, please, Louise. Next slide, please. Thank you. So why was ImpRes developed and why is this so important? So I just want to talk through this briefly. So firstly, as I'm sure we all know, evidence-based and cost-effective interventions often fail to be implemented or fail to be implemented correctly in routine practice and policy. And even when effective interventions are implemented, this can be a very drawn-out process. It's often, unpredictable, and the process can take considerable time. And this is an issue, because what it means is that despite, effort to improve the safety of health services, the quality of health services, and cost effectiveness, patients may not receive optimal care. And this, of course, can mean that it will result in suboptimal health outcomes for the patients, and can also cause more burden for the healthcare system and missed opportunities for cost savings. And so this is why there has been increasing attention, particularly in recent years, on how we can go about closing these evidence to practice gaps. And this, of course, is where implementation science comes in. The field of implementation science, as we probably all know, has experienced considerable growth over the years. But by comparison to other disciplines, I still feel really like it's in a kind of relatively embryonic stage. And many people, even those in health services research, may not have heard of it. And it is still, as I said, a very much kind of unknown quantity to many researchers. Given this, it's not surprising, therefore, that designing implementation research is often, a daunting task for people and, something that they view as highly complex. And this can be particularly the case for those that have no knowledge of implementation science. And I think this point is also partly reinforced by a study that was conducted a few years ago, back in 2018, by Erica Crable and colleagues. And this looked at Enola Proctor's 10 key ingredients that were suggested as important to consider when writing implementation research grant proposals. And the study evaluated the quality of 30 grant applications submitted to a call for implementation science and found that most of these proposals performed poorly on most of the 10 criteria. So, for example, 2/3 of the proposals incorrectly described intervention as an implementation strategy, and a similar number didn't describe or consider implementation science-related outcomes or how these could be linked to the objectives. Next slide, please, Louise. So concerns have been raised about the lack of guidance to help design implementation research. So, for example, the lack of guidance on selecting implementation strategies or the lack of guidance around theories and how to select the best one. And while there have been efforts to address these concerns, so on the CIFA website, so the Consolidated Framework for Implementation Research website, they have their implementation strategy matching tool. Or the University of Washington is another example where they've provided guidance on their website on how to pick a relevant theory. It can still really be an overwhelming task for researchers to pull all this information together and make sense of it. And this can particularly be the case for healthcare researchers without implementation science expertise. And they're left sort of grappling with looking into how to design the research themselves and searching through a plethora of publications and resources to decide what is best. Next slide, please. So we developed the Implementation Science Research Development Tool, or ImpRes for short, and the supplementary guide to go with it, to provide healthcare researchers with a step-by-step approach to designing high-quality implementation research. And more specifically, we aim to identify the core principles and concepts that research teams should consider when designing high-quality implementation research, and also to identify and synthesize key literature containing guidance and recommendations for designing and evaluating implementation research. Next slide, please, Louise. Okay. Now, just so this doesn't get lost at the end of the talk, I just wanted to flag a couple of resources that you can look at if you're interested in learning more about ImpRes, because I don't have time to go into too much detail on these here. But the first resource is a paper that Louise did a brilliant job of leading on, that myself and others were involved in. And this discusses the development of ImpRes and its supplementary guide. It was published in Implementation Science, and when we last checked the metrics, it had been accessed over 29,000 times. So it's generated a lot of interest, which is really great. Next slide, please. And then the other resource to highlight here is the guide, which shows you how you can apply ImpRes when developing implementation research. And both these resources can be accessed free online, so you can just Google them if you'd like to have a look at them in more detail. Okay, next slide, please, Louise. So taking a step back now to discuss how ImpRes was developed. So this was a multi-stage, multi-method approach, and work began in 2015. So we did several brainstorming exercises to inform important components or domains to include in the ImpRes tool. And this was done with members of the Centre for Implementation Science at King's College London, which is where Louise and I were based at the time. And also those we worked with who were part of a research organisation called the CLARC, or now known as the ARC, that we worked within. And we also consulted with international implementation science experts. And this brainstorming exercise was very much, an iterative process. In addition, we conducted a review of the literature to identify resources and articles containing guidance and recommendations on the design and evaluation of implementation research. And then information gathered from these stages was used collectively to inform the core domains of the ImpRes tool, and additional expert input into the content of specific domains was then sought. So, for example, we had a domain on economic evaluation, and for this, the health economists with a special interest in implementation science were consulted with to help to decide what important information to include. The tool was then piloted by health services researchers within implementation science expertise, without implementation science expertise, sorry. So this was obviously the intended target audience of the tool. And then they provided feedback on improvements. It was applied to 15 implementation science research projects, either prospectively, so at the project design stage, or retrospectively, after after sort of all project design decisions had been made or the project had been completed. And here we took a very sort of pragmatic and flexible approach. So researchers could either complete the tool independently and then participate in a one-to-one feedback session, or they could complete the tool with direct facilitation provided by an implementation scientist. And researchers applying the ImpRes tool were asked to complete 10 sections corresponding to the 10 domains of ImpRes, which I'll speak about shortly. And they were asked to complete a short questionnaire indicating their level of agreement with 11 statements relating to the structure, content, and usefulness of ImpRes. And the responses were on a 5-point Likert scale ranging from strongly disagree to strongly agree. So, for example, one of the questions asked about how easy ImpRes was to understand. And then there was also the option for participants to provide free text comments and critiques. And as part of this development process, a supplementary guide was also developed to help maximise the use of ImpRes and its potential benefits. Next slide, please, Louise. So this diagram lists the domains. There are 10 in total, which I'll talk about on the next slide, but I think it's just important to flag here that all the domains should be considered, but not all will be equally applicable or feasible to explore in every implementation research study. Next slide, please, Louise. So this slide lists the 10 domains again. So in brief, the first is research characteristics. So this covers the importance of considering the stages of implementation and where your study might fall, whether this might be, for example, the exploration phase or the full implementation stage. And it also discusses examples of study designs and how appropriate these may be for your work. So, for example, implementation effectiveness hybrid designs. Then we have a domain on theories, models, and frameworks, which considers why using a theory is important and how we can use these theories. Then there's one on contextual factors. So these are factors that could facilitate or impede implementation. And this domain discusses, for example, how different frameworks, such as the CIFA framework, can be used to help assess these determinants. And there's a domain on implementation strategies, so the things that we put in place to help to facilitate the implementation of the intervention. And the ImpRes guide here draws a lot on the work of Proctor and Waltz and what they did in their papers on developing a compilation of implementation strategies and then mapping these strategies into different categories. ImpRes also highlights the need to ensure service and patient outcomes have been properly considered and are measured appropriately. And then this leads on to the importance of a separate domain which focuses specifically on implementation outcomes. These tell you how well the implementation of your intervention is working. And so you could be looking at things here like the acceptability of the intervention, its feasibility, adoption, or cost. And then unintended consequences are also highlighted. So these could be good or bad. So I think it's important to mention here that even if research achieves its anticipated outcomes, there may also be unanticipated or undesirable consequences. So it's important to consider how to capture these so that they can be borne in mind for when, example, we're scaling up the intervention on a larger level. And then the final few domains, so there's one on economic evaluation. So, you know, it could be considered that there's less value in developing and testing an intervention on a small scale that is shown to work if there is not then adequate resource to scale this up and spread it out so more people can benefit. So ImpRes discusses, you know, why this is important and how you can assess this. And then we have a couple of domains that focus on stakeholder engagement. The first one looks at kind of wider stakeholder engagement and how it's important to involve stakeholders at all stages of research, not just at the end when it can be viewed as a tokenistic time point. And then patient and public involvement as well, which is also part of wider stakeholder involvement. But the ImpRes guide really encourages research teams to distinguish and consider patient and public involvement separate to wider stakeholder involvement, given its importance in facilitating the implementation of research interventions into clinical practice. Next slide, please, Louise. So just a couple more slides before I pass over to Louise. So I touched upon briefly before that participants who applied ImpRes were asked to then complete a questionnaire on how they found it. And this slide just summarises some of those findings. So in brief, 13 questionnaires were completed out of a potential 15 participants, and the higher the score, the more agreement there was with the statements. So patients had to answer questions in relation to the structure and content of ImpRes and also its usefulness. So I've given some examples in the table here. And you can see that there are some areas that were sort of noted more for improvement in terms of, the researcher said that the tool was time consuming to complete, and it was, it was quite long. And so these, of course, could be considered potential barriers to use. However, overall, the tool was viewed really favourably, and researchers found it easy to understand and logical. Next slide, please. And since ImpRes has been developed, it's been used in a number of ways. So I just wanted to very briefly highlight some of the impact it has had. It's been used to develop protocols on hybrid studies, and we have seen this through publications in implementation science-related journals. It has also been used by various research organisations and as a recommended resource on websites such as the Imperial College London's Research Support Hub. Next slide, please, Louise. And learnings from ImpRes have also been widely disseminated in journals and conferences, both nationally and internationally. And this slide shows some examples. It's also been used in teachings at undergraduate and postgraduate level and other courses and implementation science masterclasses, and has led to some research collaborations too, which has been really great. Next slide, please. And also just to say before I end my talk, as a reminder, the ImpRes resources are free, so please feel free to use them and download them. We want as many people to use them as possible so we can learn more about its application. And as I said, any questions that people have today, please feel free to reach out to me via email after this session. And I'm now going to pass over to Louise, who's going to talk about the follow-up work we conducted on ImpResPAC.
Thank you, Rachel. Thanks for such a comprehensive overview of the ImpRes tool and guide. Just a quick note, we're currently updating the ImpRes tool and guide. So it was published in 2019, and since then there's been a lot of guidance, tools, resources that have been published to help people design high quality implementation research. So that update is currently underway. So yeah, keep your eyes out for the updated version. So moving on to the ImpResPAC tool. So what is ImpResPAC? So when we decided to develop ImpResPAC, the main aim was to develop an in-depth and comprehensive tool to assess the conceptual and methodological quality of implementation research proposals, specifically within healthcare. And we believe, to the best of our knowledge, that ImpResPAC represents the first quantitative appraisal tool for evaluating implementation research proposals that incorporates state-of-the-science guidelines and recommendations, and it's based on the input from a large international expert advisory panel. So what was our rationale for developing ImpResPAC? Well, as Rachel mentioned, there are a number of resources that have been developed to support research teams to design high quality implementation research, ImpRes being one of them. And there's a number of resources that have been designed to support the design of very specific elements of implementation research. So, for example, the implementation outcome repository that I designed with colleagues at King's. This is a resource to support research teams to identify quantitative implementation outcome instruments and select them based on their psychometric properties. There's the TCAST tool, which is a tool to support the selection of implementation theories, models and frameworks, and so forth. And there's a number of interactive websites that have been designed as well, and also websites which contain numerous resources to support the design of implementation research. What we've also seen in the literature as well is that there are a number of reporting guidelines for implementation studies. So probably the best well-known is the STARI guidelines. But since that was published back in 2017, there's been numerous reporting guidelines developed for very specific elements of implementation research. So we have ones for implementation outcomes now, adaptations and modifications to evidence-based interventions, and also recommendations for specifying and reporting implementation strategies. And because there were so many of these reporting guidelines, I decided to put them all in one place and developed a resource which contains guidelines relevant to implementation studies. So if you're interested in having a look at that, I can signpost you to that one. But that was based on searching through more than 550 guidelines that are published on the Equator Network to identify reporting guidelines relevant to implementation studies. But what we did find is actually there was a massive gap. So although there was so many resources for designing implementation research, so many guidelines for reporting implementation research, very little attention had actually been directed to appraising the quality of implementation research proposals. And what we didn't know at the time when we started to think about developing ImpResPAC and started working on ImpResPAC is actually there was a team based in the States that were also doing the same thing. And I think it was in 2018, Erica Crable published the InSPECT criteria, which, as Rachel mentioned, this is based on Proctor's 10 key ingredients to implementation research. And it was based on the team's experience and expertise of writing for funding, specifically within the United States. So it calls into question whether or not this is applicable, the criteria outside of US funding agencies. So why is it important to appraise the quality of implementation research? Well, poor quality implementation research, we argue, would be unlikely to result in the successful implementation of evidence-based interventions. And then obviously that has an impact on improvements in healthcare delivery and outcomes. And it also hinders the advancement of implementation science as a field. So really, we argue that developing and submitting high-quality implementation research proposals and also identifying the best implementation research proposals to allocate funding to is critical to advance the field, but also, most importantly, to make those improvements in healthcare delivery and patient outcomes. So in terms of the methods that we used a two-stage mixed methods design, which included a two-round modified e-Delphi. Stage 1 involved content development of ImpResPAC, and then stage 2 was the expert content validation and refinement of ImpResPAC. So in terms of stage 1, as Rachel mentioned, the content of the tool was based on the ImpRes tool and guide, and we really used this as a starting point to develop the content, the criteria within ImpResPAC, and this resulted in the initial development of 55 domain items across those 10 ImpRes domains. And at this stage, we also developed an overview of ImpResPAC user instructions, scoring instructions, as well as the scoring scale and associated anchors. And these are just some examples of the ImpRes domain items that we developed at this stage. So for the implementation research characteristics, this is just one of the items that was developed at this stage. So implementation aims and objectives are explicitly and clearly articulated and align with the proposed project design methods and measures. A domain item for the implementation theories, models and frameworks domain was clear, detailed and strong justification is provided to support the selection of implementation theories, models and frameworks, supported by appropriate literature and or data from implementation sites. And then just another example of a domain item from the implementation outcomes domain. So the proposed project includes the evaluation of implementation outcomes. So moving on swiftly to stage 2, once we had our 55 domain items and our user instructions and scoring, we sought to form an expert advisory panel. So the ImpResPAC development team, we developed a list of experts who we had identified as having made a significant contribution to the conceptual and methodological advancement of implementation science. So those key kind of publications we used to identify those experts, as well as our collective knowledge. And then once experts had been approached and agreed to participate, we asked them and encouraged them to nominate additional experts whose contribution to the development and refinement of ImpResPAC would be of value. So this resulted in more than 200 experts being invited to be members of the expert panel, and in total 68 experts agreed to participate, representing just over a 30% response rate. And as you can see, most of those experts were located in the USA or the UK, but we did have some experts from Australia, Sweden, Germany, Norway, and Cuba. In total, those experts that participated had more than 730 years cumulative years experience in implementation science and more than 370 years experience in reviewing implementation research funding proposals. And what we've done is we provided them with the ImpResPAC domain items that were associated with their expertise. So some of the experts received, for example, the implementation outcomes domain, and they just reviewed that domain. But we did give them the opportunity, if they felt that they had expertise in other domains, that they could also review those domains. So not all 68 experts reviewed ImpResPAC in its entirety. They just reviewed those domains that they felt they had the expertise to do so. And we asked for both qualitative and quantitative feedback on the ImpRes tool. And I think that we were really surprised by the amount and detailed qualitative feedback that we did receive. And based on that feedback, we made extensive revisions to the tool at this stage. So we modified 41 of those 55 domain items. We included an additional 20 domain items. We removed 5. We split one domain item into 2, and then we merged and modified a number of other domain items. And then at this stage, the number of domain items increased from 55 to 67 domain items. So this is just to give you a flavour of some of those revisions that we made. So for an implementation research characteristics domain, so this was the original one, and then I've just highlighted where we've actually made some of those revisions. And then this was an additional domain item. So this was in the implementation determinants domain. So the context in which the proposed study is to take place and implementation determinants either theorised and or identified are clearly described. And then we removed this particular domain item from the implementation determinants domain. I'll explain why in a minute. So an appropriate theory, model, or framework has been selected to identify and understand the factors affecting implementation success and failure. And a number of experts requested that this was removed because there was a similar item within the implementation theories, models, and frameworks domain. So they were just quite conscious that potentially we could be kind of double counting the same kind of indicator of high quality implementation research just because it was covered in 2 domains. This is just an example of one of the domain items that we merged and modified. So in the implementation strategy domain, we had 2 separate domain items relating to the intention to involve stakeholders and patients in the public in identifying and selecting implementation strategies. And it was recommended by a number of those experts to actually merge these and just have these as relevant stakeholders, which would include patients in the public and other stakeholders as well. And then this last example in the implementation outcomes domain. Experts suggested that we actually split this into 2 domains, which we did. And then these are some of the other revisions that we made, in addition to the revisions that we made to the ImpRes domain items. So we renamed 2 of the domains. So we renamed implementation theories, frameworks, and models to implementation theories, models, and frameworks. And this was a point that was picked up by many experts just to ensure that the name was in line with widely accepted wording and abbreviations within the field. We also renamed the implementation determinants contextual factors just to implementation determinants, just to ensure that the focus wasn't exclusively on contextual determinants. And then we replaced the term project with proposal, just to reflect that the focus of ImpResPAC is to appraise the quality of implementation proposals rather than implementation proposals and completed implementation research studies. We also revised the midpoint of the scoring anchor from satisfactory to fair in response to comments made by one member of the expert panel, and we also revised the scoring anchors to include suggested percentage cutoff ranges relating to the percentage of items that were addressed within ImpResPAC. We also made an additional revision in terms of how the global ImpResPAC score was calculated. So originally we recommended that it was calculated using the cumulative total of domain scores, and then this was changed to calculate the median, and this was just to allow users of ImpResPAC to easily compare the quality of two implementation research proposals with differing number of applicable domain items. And we also developed a supplementary ImpResPAC glossary as well. So ImpResPAC contains numerous terms and acronyms, and we decided on the recommendation of the expert panel to develop a glossary just to ensure that the terms weren't open to interpretation in any way. So the second round of the Delphi, again, the expert panel provided extensive feedback, and we made additional revisions, not as many though in round one, which was good. So we made 17 modifications. We added an additional 4 domain items. We didn't remove any, and we split one domain item into 2 domain items twice, and then there was no merger or modification. So after this round of feedback, the number of domain items in ImpResPAC increased from 67 to 71. So again, I won't read these out just because I'm conscious of time, and it would be good to have some discussion, but these are some of the just examples of some of the revisions that we made to the domain item. And then again, in addition to the revisions that we made to domain items, we also made a number of other revisions, and these are just some of the examples. So we clarified that the ImpResPAC domains and domain items are weighted equally rather than not weighted, and this was just based on this feedback that we received from one expert. And then there was clarification that although some of the ImpResPAC domain items reference very specific tools and reporting guidelines that are indicative of excellent conceptual methodological elements of implementation research, it is actually possible that an ImpResPAC criteria can be fully addressed without specifically referencing those very specific guidelines and recommendations and resources. So in terms of the final structure of ImpResPAC, so it contains 10 distinct but interrelated domains, and these are exactly the same domains as what is contained within ImpRes, although there's slight modifications in terms of 2 of the names of the domains, but each domain represents a core element of implementation research. And as I said, those domain items are equally weighted. And then, as I've just said, ImpResPAC contains 71 domain items across those 10 domains. They aren't equal, so there's some domains have more criteria than other domains, but the domain items, like the domains, are equally weighted. So this is what one of the domain items look like. So this is the implementation outcome domain. And as you'll see, some of these terms are in orange, and all terms in orange are hyperlinked to the ImpResPAC glossary. So if you are a researcher new to implementation science and you go to the implementation outcomes domain, you realize that you haven't actually planned to evaluate any implementation outcomes, you don't actually know what an implementation outcome is, that will take you to the ImpResPAC glossary. There'll be a nice definition of what an implementation outcome is, and then it also directs you and signposts you to key papers relating to implementation outcomes. And then, as I said at the beginning of the talk, ImpResPAC domain items do incorporate guidelines and recommendations, and these are referenced throughout. So this is just an example from the implementation outcomes domain. So as you can see, 3 of the domain items do incorporate 6 practical recommendations for improved implementation outcomes reporting. And then in terms of ImpResPAC user instructions, they are quite extensive, but I just wanted to draw your attention to the fact that given the scope and diversity of implementation research proposals, that not all ImpRes domains may be applicable. And even if they are applicable, then maybe not all ImpResPAC domain items might be. So for example, there could be a study which is looking purely at identifying implementation determinants, and they've selected just one implementation determinant framework to guide that work. So it makes sense that actually this particular implementation, ImpResPAC domain item wouldn't be applicable, because it speaks to when research teams use more than one implementation theory, model, or framework within their study. This is just an overview of ImpResPAC scale and scoring anchors. So each of the domains is scored on a scale of 1 to 5, 1 representing very poor and then 5 representing excellent. So in terms of the ImpResPAC evaluation, I'm just going to whiz through these slides just because I'm really conscious of time, but we did ask the expert panel quite a few questions relating to ImpResPAC. So 83% of the expert panel agreed or strongly agreed that ImpResPAC provides a comprehensive, transparent and fair appraisal of the conceptual and methodological quality of implementation research proposals. We asked them numerous other questions. So, for example, 95% of the expert panel agreed that the domain items represent and reflect high quality conceptual methodological elements of implementation research proposals. Interestingly, we have had feedback that there are a lot of domain items, 71, even so, a number, nearly over a quarter of experts thought the word domain items missing, so potentially it could be included. We also asked the expert panel regarding the appropriateness, acceptability and feasibility of implementing ImpResPAC from different user perspectives. So these are just the results from researchers and practitioners. So 91% of the expert panel agreed or strongly agreed that ImpResPAC was appropriate for use by researchers and practitioners. 86% thought it was acceptable and 81% thought it was feasible. These numbers went slightly down when asked in relation to use by educators, and again they went slightly down in relation to the acceptability, appropriateness and feasibility from grant reviewers' perspectives. This is just some of the qualitative feedback that we received, some of it quite conflicting. So we had the tool is comprehensive but likely to be too detailed to be of value for researchers and reviewers. And then in contrast, the length of the tool and scoring method are appropriate. We had, I'm unconvinced of the role of tools of this kind in appraisal in general. It's not a specific critique of this tool in particular. And then we had one expert saying that it provides a clear, standardised way to evaluate proposals. The expert panel identified more than 30 funding bodies and programmes that they believed that ImpResPAC would be of value to, and this is just some of the examples of the funders that they identified. And then we had some more general comments that a number of the expert panel just thought that it would be a valuable tool to any funder that is funding implementation research. And just to know, we when we developed ImpResPAC, we didn't intend it to replace the criteria of funding bodies. Rather, we wanted it to be a complementary tool that strengthened the review process and just make it a bit more objective and transparent. And as you'll see from some of the screenshots, we commissioned a creative design company to develop an interactive PDF to promote the use of ImpResPAC, and that is widely available. So just based on the evaluation of ImpResPAC today, we see that there's going to be some significant and immediate benefits. So specifically in relation to research teams, we think that they can use that to identify weaknesses in their implementation research proposals prior to funding, so they can actually identify and address those. We think that it will be useful for grant reviewers in identifying the most promising implementation research proposals to fund. And also we think that ImpResPAC could serve as a valuable resource for educators who are responsible for assessing proposals that have been submitted as part of training and teaching programs. We are currently evaluating the usability and the psychometric properties of ImpResPAC, and to do that we are applying ImpResPAC to evaluate the quality of protocols published in implementation science. So I think we're going to get some really interesting findings in addition to the psychometrics of those. And I'm currently working with research teams in Japan and also Brazil to translate ImpResPAC into Japanese and Portuguese. And if you want to find out more about the work, we published a protocol paper in BMJ Open. The paper is currently under review in Implementation Science Communication, so hopefully that will be published soon, and the ImpResPAC interactive PDF is available from the ARC South London website, and I've just included the link there. So moving swiftly on to questions and answers. Sorry, I felt like I had to rush through that just because of the technical problems at the beginning.
Not at all. Thank you so much. This was so helpful. What a rich body of work to both of you. I know that Rachel had to step away, so it's you are alone, Louise, at this point with this. I wanted to see whether there are any questions from the audience to start with. I had a couple of follow-up questions, but I want to make sure that we actually open it up. So feel free to use the chat or unmute and ask your question.
Yeah, please do.
Any immediate questions?
I have one question about the different domains. Sorry, I can't be on video right now. But I saw that the domains are weighted equally, but you can also not score some of the domains or say they're not applicable. So I'm curious about when you would decide that a domain is not applicable versus just wasn't addressed. So like, when do you decide if it should have been included and wasn't versus wasn't included and that's okay?
Yeah, that's a really good question. I think it really depends heavily on the scope of the proposal, because you could imagine if you're submitting a large program grant, for example, it's more likely that more of those domains will be applicable. But for example, if you're developing a proposal which is far more contained, so for example, a really basic example, if you're at the stage where you are identifying implementation determinants, and that is the proposal, then potentially the implementation strategy domain wouldn't be applicable at this stage. That would come a little bit later once you've identified your key implementation determinants. There are some domains which I do think will always be applicable. So, for example, the implementation research characteristics domain, that will always have some applicable, that will always be applicable. Maybe not all of the domain items will be. So, for example, within the implementation research characteristics, if you're not planning to adapt or modify the evidence-based intervention, then that particular implementation, that particular ImpResPAC domain item would be not applicable. So yeah, there is some judgment that is required in terms of classifying whether a domain or a domain item is either not applicable or it just simply hasn't been addressed when it should have been.
Yeah, thank you.
And I think that's what's come out, actually, just trying to apply the tool to appraise those protocols published within implementation sites. There has been a little bit of discrepancy in terms of that not applicable and not addressed in relation to unintended consequences. So I think that, yeah, there's probably going to be room for refining the ImpResPAC instructions based on the work that we're doing now. But yeah, that's a really good question.
Thank you so much. I realize we are at the top of the hour, which is very sad. I had like 6 questions, but let me say that this was so helpful. Thank you so much for sharing this with us. We are going to be making the recording available. You already offered a couple of times that people can reach out with follow-up questions. I will just leave us there that one thing that was moving in my mind, and we cannot discuss, but we will perhaps in the future, is how AI programming of this criteria would help people kind of in a more efficient way, because I think the detail, which should not be lost, was one of the criticism, could be used to, you know, kind of apply this criteria in a more kind of seamless way as they are writing grants and get feedback related to this criteria.
Yeah, absolutely. That's yeah, something I had considered, but probably it should in the future to see how that can really identify those weaknesses. What I would say is if research teams do apply ImpResPAC and they identify weaknesses in their proposal, that's where they can then go to ImpRes to strengthen that particular element of their proposal. So although ImpResPAC is based on ImpRes, they're very much complementary tools in that respect.
Fantastic. Thank you so much, Liz. I really appreciate your
Thank you so
time.
much for the
Everyone,
opportunity.
thank you for being here, and hopefully we will see you in the near future. And thank you for your excellent work and contributions to the field.
Thank you. Thanks so much.
Thank you, everyone. Bye-bye.
Bye.